Ewa Odachowska, transport psychologist, psychotraumatologist, Motor Transport Institute. Traffic accidents may cause not only physical but also psychological consequences. For example, most common connected to the traffic accident are connected to the stress, and this is, for example, post-traumatic stress disorder or some mood disorders, for example, depression, and also anxiety disorders, for example, fear of driving, and also many diseases connected to the mood and purpose in life, meaning of life. When we are talking about methods connected to the measurement of psychological consequences of road accidents, we can use the tests, we can use some categorization, we can use classification, for example, ICD or DSM. This is the classification about mental diseases and the mental cost of some kind of situation in life. So that's why we use also some diagnostic tests connected to the event and the result of this event, for example, as a PTSD measurement or the depression measurement or the whole scales connected to the purpose in life. We know that the psychological consequences may cause a lot of costs, not only in mental health, but also sometimes in somatization. So this is also a physical thing. So that's why, for example, when we are not treating the diseases, for example, PTSD, they may have the connection to the somatization after, for example, 2 years after accident. So we know that if we will not cover these psychological diseases, they may cause a lot of things, not only mental, but also physical consequences for a person. For many years, mental illness wasn't that important. The research connected to the traffic psychologists and consequences of a road accident. But right now we know that the mental health is also very important to get person back to society, to back to the family, to back to the friendship, because sometimes after the accident, when you have PTSD, for example, then your life is completely changing. This disease is connected to the changes in your brain, so that's why the time doesn't look the same, the world doesn't look the same. In clinical psychology, we are saying that the whole world itself doesn't change, but completely this accident completely changed your thinking about this world. So this world is like danger, not that safe as it was. So that's why when we are thinking about mental health, this is thinking about whole person, not only connected to the body, but also the head and the mind. And this is very important to get health whole person.